Hi, good morning, everyone. All three have joined already. Good to see. Ian, we just just chatted about a few things. I'll just, in the chat bit, if you can just add in that portal address, that'd be great.
Yeah, no problem. Do you want to do it now or just when you mention it?
No, wait till I mention it, that'll be
Okay.
really good. Hi, Ian, I'm going to use my tester again. Can you just confirm that you can see that? That should just be the first page of the presentation.
Yeah, I can see that, and you sound fine as well.
Great stuff, thank you. Hi, good morning, everyone. I'm just going to not quite talk rubbish, but I'm just going to talk for a little bit. I just find it, I know from my point of view, I find it helpful when you go to join a presentation or a webinar like this, if you can hear that there's someone actually there. If you just get a blank screen, you don't actually know whether you're properly connected or not, and then all of a sudden the presentation might start. So hopefully everyone can see something on their screens when they join, and they can hear me as well. We'll give it till probably just after 1:30 before we start, which is going to be a few minutes yet. So like I say, I'll just waffle on for a little bit. It's a lovely morning here in North Lincolnshire where I am. Sun shining, the garden looks really nice, except the grass needs cutting. That could be a job for later. I hope everyone's having a good day so far this morning. What have I done this morning? I fed a horse and taken the dog for a walk, usual stuff. Chickens are shouting at me because they want feeding, but they can wait till later. I've got a very noisy cat that's wandering around. It's a whole collection of animals there that we appear to have. Hopefully the dog and the cat won't start fighting as they did earlier on. I'll just keep everything nice and quiet. As you can guess, I'm working from home, which I know isn't something that all of you in primary care are able to do. It is something that I think a lot of people have found really useful. And after the whole pandemic, I think many people will be reluctant to go back to the way we were before. I know within N3I where we adapted to the working from home, and we go in occasionally to our offices, our nice new offices, which for any of you who've ever visited them, just across the Humber Bridge. As you go over the Humber Bridge, heading north, you come to that very first roundabout. We're literally the building on the corner as you look across. N3I are based in the ground floor of that building. And also, we've got some nice new vans now. So you can see our logo, the logo that's on the screen at the top left. We now have got these white vans. I think we've got two, or do we just have one? I'm not sure. But they've got the big logo now all over them. The engineers will use that to take computers around and when they're doing visits and so on. So they're very smart. Well, we're 28 minutes past. Okay, yeah, give it another couple of minutes. As I said, so for those of you who are just joining, my name is Barry Jackson. This is a presentation around the Data Security and Protection Toolkit. So what I'm going to do is, obviously, in terms of the system, it's an online system, and when you log in, it has loads of questions. There are, I think there's some 60 or 70. Well, they don't even call them questions anymore now. They're called assertions. And dependent on the type of organization you are will depend on which ones you are get told to answer. So it's no good me running through the actual system itself that I've got, because as on my system N3I, we get a different set of questions to the ones you get. So what I'm going to do is the system also provides us with a spreadsheet which shows all the different breakdown of who gets which questions. So I'm going to work off that to go through one by one, and I think it's about 13 assertions that you have that you need to reply and put something in against. And of those, again, about 5 or 6 are actually ones that you need to refer to us anyway. So they're ones that ask you technical stuff around networks and software and things like that, which we'll provide you with the answer with. So there aren't a huge number that you have to do. Obviously, we've been doing this for a number of years now, so hopefully this isn't new to anyone either. And all the stuff we've got, virtually, I think for every question, if it asks you to produce something, if it wants a list of something or a register or whatever it is, then we've got a template available for you, and you can just use that. Obviously, you can make your own and develop your own. You can Google virtually any of the questions on here. The system itself has a number of templates available, so there's plenty of help for you out there in terms of developing things for you to record. All you need to do is actually ensure that you're doing the actual activities. So if it says, do you do certain types of checks or something like that, there'll be a template there for you to record those checks. You just need to actually be doing them. Okay, but we'll get into that in a few minutes. Okay, I'll make it 1:30. I'll give it a couple of minutes and then we'll make a start. So as I said, I'm going to keep talking, just not quite saying a whole lot at the minute, but just so that when people join, you can get the volume sorted out and ensure you know you're at the right place. This should take about, I don't know, half an hour or so, I guess. I know you're all very busy, lots of stuff to do, so we won't labour too many of the points. We'll just go through them slowly as we normally do. I'd say probably about half an hour or so. And as always, if you've got any questions at all, well, on this, it's probably easy if you save your questions to the end. I'll pause a couple of times as we go through, but I think we'll probably leave questions to the end, and then I'll go through them all, write them into the chat function if you want to as well, if you find that easier, or just shout out at the end. But also follow up if you think of something later on, or if you're unsure and you don't want to ask a question, just drop me an email, and we'll pick it up afterwards. Okay, so it's gone 9:30, so I think we will make a start. This has been recorded and it will go onto our web portal later on today. So for those of you who miss it, or if you have to drop off and go off and do something else, don't worry about it. As I say, you can pick it up later on. Yeah, that's what I just need to tell you. It's been recorded. I think that was the main thing. Okay, let's make a proper start then. So good morning, everyone. My name is Barry Jackson. I'm Head of Information Governance at N3I. As part of that, our job is to provide you with an information governance service, which is what this is an element of. A large number of you also have nominated myself as your data protection officer, but this is specifically more around the wider information governance remit. And it's a presentation on the Data Security and Protection Toolkit, which is due to be submitted by all of you, all organizations, by the end of June. Eek. That wasn't very clever, was it? I'm starting my presentation and now I'm on mute. Can someone confirm they can hear me okay?
Yeah, I can hear you just fine.
Great, thank you. Thanks, Ian. So hi, I probably need to start a bit again because I just realised I was on mute, which isn't very clever. So we will make a proper start. Good morning, everyone. My name is Barry Jackson. This is a presentation on the Data Security Protection Toolkit. It's part of the information governance service that you'll get from N3I as part of your contract. And what I was just saying before I realised I was on mute is that this has been recorded. So if you need to leave, or if you can't carry on watching it now, it'll be recorded. It'll be available on our website just after lunch, I think, by the time we get that sorted. If you've got any questions at all, probably easiest to leave the questions till later, and we'll cover them all off. But also write them into the chat function if you've got anything you want to ask, or drop me a line after the presentation is finished, and we'll pick them up then. So while you're here, I'm just going to very quickly run through a couple of other updates that I think are pretty important, just IG stuff that we're doing at the moment, just so you're all aware of it. So an update on this one, deceased records, which appears to have been going on for ages now. You may have seen that in the new GP contract, there was a letter that spoke about two things that were going to happen with this, and it didn't give any detail, but it spoke about in sort of big picture stuff, that you won't have to print off records in the future. That concept will cease. So save forests, millions of trees, I should think, by not printing off the record of everyone who's deceased. But because you're not printing them off and sending them back to PCSE, you will have to deal with requests that will come in for access to deceased records. So they're the two big things, and they were in the GP contract letter that came out. What we haven't had yet is the actual guidance about how this will happen. There's an awful lot of bits around the edges of that about, okay, what will happen with this, what happens with this, what happens with this, and when will this actually start? So at the moment it hasn't, and I have to say that I'm on a working group which has its first meeting this week with NHS England to start going through those details, or at least to find out what the details are and what their plans are. So when that working group sits this week, I'll be able to update you about how this is actually going to happen. But at the moment, it hasn't actually come into play. So you should be doing the existing service, if you like, but it is obviously going to change quite significantly fairly soon. The patient online record access is coming. It's been postponed again, as I'm sure you know. The webinar I was on last week appeared to indicate that it will be coming in the summer. It's pretty much what they said. They've gone from being a fairly specific month to now just saying sometime in the summer, but they have pretty much guaranteed that we will get 2 months notice. So whenever they announce what the date's going to be, it'll be 2 months away. And but what I would say is don't wait for that. I think most people's assessment of this is that yes, it has been postponed, which is, well, disappointing, depending on your view of things, but it will be coming. I just think fairly determined to push with this one. Whilst many people have some concerns and they're being addressed at the moment, I don't think any of them are going to be showstoppers, if you like, and I don't see that there's a huge groundswell of public opinion against it. Indeed, it's probably the opposite. I think the majority of the public would think this is a good thing and will be wanting to push to have it put in place. So it is going to come. You need to be thinking about the processes, reading up on it. There's loads of guidance on our web portal, and so, but obviously I'll be doing more stuff as we get nearer the time. We've changed the guidance we have for people who want to work overseas. I know we've had a number of requests from generally GPs. I think we have a couple who kind of split their time between homes, certainly one in Switzerland, and there are other places across Europe where they have a home. They do so 3 months away and 3 months back, and so they can use this concept of working overseas. People go on extended holidays as well. What we say is that as long as your system, you use one of our systems, it's all up and running, it's all been logged on and checked, and it's got its updates and all functional, you can take one of our laptops overseas. The ICO has said that you can work with a proper VPN system, isn't classed as transferring the data, it's classed as working on it, and the data stays where it is essentially. The only thing that changes in light of some of the recent events, if you like, on a global basis, we've restricted it. So it used to be that you could access from literally anywhere in the world, but on government advice, we've restricted our technology to only work in certain areas. If you want the specific place destination, you probably need to check with us. But in general, most of Western Europe and North America would be fine. Other areas, not so much, and you'd need to check with us to see what a specific country might be. CCTV, again, just a reminder to you, because it's come up a few times over the past few weeks, to be aware of what your CCTV is doing. If you're in a building where you have CCTV in place, just be aware that people can ask for the pictures, but also what you're doing with them as well, if you're monitoring them. Particularly aware if your cameras monitor activity outside on a main road, for example, a road that runs past the practice. That was an issue we had this week where there'd been an incident on the public road and on the footpath, but it was picked up by the camera. You think about what happens if people come and ask for it, for the images that were taken. Retention periods, how long you're keeping stuff for, and probably also, if you think about your CCTV, also think about your telephone systems, how long you're keeping information on there that people may want to ask for. And a point that we're going to mention a few times during this presentation is around the legal basis. To process anyone's personal data, you must have a legal basis. And there are a number of them, and I've done presentations on this before. Again, there are guidance documents available. For the overwhelming majority of work you guys do, it'll be direct care. If you're providing healthcare to a patient in any way, shape or form, then that's your legal basis. We need to move away from this idea of using consent. There'll be very, very few occasions when it's appropriate to use consent. And in terms of delivery of healthcare, it's never appropriate to use consent. That almost sounds wrong, but it isn't. It's a GDPR thing that there are better things than consent, because consent brings other problems with it, if you like. It's not necessarily wrong, it's not a bad thing, but it brings other problems. So you're better off just saying it's provision of healthcare, which is actually what it is. The only time I'm thinking of an example of consent would be where you're using, if you have a patient participation group, the people who are involved in that, they're not getting healthcare, they're either coming along or you're interacting with them via email, whatever, in terms of their membership of your patient participation group. So their processing will be based under consent, but where they're coming to see you for treatment or anything else, it's more likely to be just simply direct care. And it's worth trying to remember that, trying to think that we need to stop the focus on consent, because it doesn't work. Again, guidance document on that, as you'd know, on our web portal. I'm going to put the link there, although it wouldn't work from the presentation clearly. I'm going to ask Ian just to put it into the chat function on the presentation here, so you can access it. There's loads of stuff on there. I've just literally put something again on this morning, which gives a load of policy templates in the blog section. All the things I mentioned already: deceased records, online access, working overseas, CCTV. There are blog posts, there are fact sheets about all of this already. So that, please keep having a look on there. And I can almost guarantee that any question you've got around stuff today, around data security and the data security protection toolkit, the answer will be in there somewhere. Okay. Right. What I need to do is now pull up this. Can you see that spreadsheet or not? I'm not sure if I've got the sharing right on this.
You can just see the PowerPoint. There's no spreadsheet.
You can still see the PowerPoint. Okay, let me just change how I'm sharing this. I'll share.
There we go. I can see it now.
Great stuff. Thanks. All right, guys. So as I mentioned earlier, the Data Security and Protection Toolkit is it's an online web thing. You guys all know where it is, I'm sure. I'm not going to. We've been doing it for a number of years now. It used to be called the IG Toolkit. Obviously, if you're new to this and haven't had a look at it, the first thing to do is to go onto the website and make sure that you can get your login, because we don't do local administration of it. we don't do the logins for the system. If you get locked out or anything like that, it's a centrally run system by NHS Digital. So make sure you can get logged into it. It's the first thing, obviously. As I said, when you do log in, the system itself has, I forget how many, and it's irrelevant, but there are a lot of questions, and I say they don't even call them questions anymore, they're called assertions. So there's loads of assertions in there, and then depending on the type of organization you are, you will get a certain set of them, which is why I can't demo the actual system, because my set of questions will be different to yours. So what I've done is the system gives us this spreadsheet, which is what I've got on here. As you can see, essentially your category 4, which is column G on here, and these are the green ones, which are the ones that you will get as a GP practice. So this is, although it's a very different format, these are the exact same questions as you will get within the system. And I apologize now for calling them questions. I'm going to keep doing that, although it does remind me at the top left-hand corner there that they're actually assertions as opposed to questions. Semantics, I think. So we'll quickly run through these then. And as I said, there'll be guidance and stuff as well available as we go along. So the first one's very straightforward. You need to put in your ICO registration number. If you don't know it, you can actually look yourself up on the ICO's website, put your own details in, and it'll come up and tell you what your registration number is. Okay, so the next one is talking about the list of data that you hold. I mean, this is fairly fundamental stuff here. So it wants to have something called an information asset register. And within that, you then, there's an awful lot of acronyms here, guys. I'll try and keep it to a limit. There's a thing called the record of processing activities. They're the same, well, the same thing to some extent. So if you can only process data that you've got. So if you've got an asset register and has a list of your data systems on there, then obviously your record of processing is the record of how you use those systems, if that makes sense. Again, there are examples of both of those information asset registers and the record of processing activities. There are links in here, as you can see on the spreadsheet. When you go onto the system, there'll be live links within the website system that you could go to. But also, if you were to look on the IG portal that we have, and that Ian's put the link onto, there'll be examples on there as well. They may actually link to the same thing, but there's certainly examples on there of the registers and spreadsheets. So they're just a document that encompasses the biggest thing you have, of course, completely would be your clinical record system. You may not have a whole lot more than that anyway. You may have an HR system, for example. Important to remember as a practice, don't forget about the other set. You have 2 sets of personal data. You've got all your patient data, but also as an employer, you have all your staff data. And staff data is obviously personal data that you need to ensure that you're managing and looking after to some extent the same way as you look after patient data, with all the confidentiality stuff around it as well. So the next bit says, whilst data security and protection is everybody's business, somebody needs to have actual responsibility for it within the organization. And again, I'm sounding like a broken record as I'm doing this, but on the IG portal, there's a fact sheet that sets out the people who the system would expect you to have within an organization. It's difficult with GP practices to some extent because they can differ vastly in size. There'll be some of you out there, single-handed GPs with very small staff, other larger ones, obviously with more people, but there's some very specific roles that you must have. One on here is a data protection officer. Obviously, the majority of you have me doing that for you to some extent, so that's fine. But within the organisation, you should have a lead person who's looking after information governance issues. Of course, usually that's your good selves as practice managers. But you should have a senior information risk owner, a CIRO, and a Caldecott guardian, quite importantly, within a practice. And you certainly the Caldecott guardian that I think you probably need within the clinical system anyway to do certain tasks. But it should be it's slightly wider than that. The actual role is slightly wider than just doing the clinical tasks on the system. But you must have these people in place and appointed. And the assertion here is just asking you to say, yes, we've got that. And it talks about further guidance being available at different times. Right, let's move down. Okay, so your organization must set out in clear, easy to understand language what it does with the personal data of the people it supports, staff, volunteers, members of the public, etc. So this is a privacy notice. Now, there's an almost direct problem here straight away, that because you do, the healthcare system is incredibly complex, as we know, and to try and describe that, I've seen privacy notices. I saw one that went up to something like 37, 38 pages when it got down to describing every single use of every bit of data, which almost contradicts the first line here where it says it should be clear and easy to understand. You've got to it's about getting a balance right. As it says here, the point I was just making, also you should have one for staff and one for the for patients, really, to set out exactly what you're doing. And I would just think about having the basics, having the basics of the healthcare one, saying this is what you do, things, some of the additional services, risk stratification, you may do population management, put them into, you know, a sort of little section with a link, and you can do that. You can link to something that, you know, a bigger document, a website that describes better what that is, because obviously trying to describe something like risk stratification, for example, in an easy to understand privacy notice might be quite difficult. It'll be enough just to say, we do this, you need to be aware of it as patients, and then perhaps send a link to the site that describes it better. But again, there are examples of these freely available. And if you're really stuck, Google's your friend. You know, Google, if you did a Google search for a GP practice privacy notice, given that the other thing is you're supposed to display these privacy notices on your websites, you'll get hundreds of them that have been done by your colleagues. And I don't never see any problem in pinching someone else's work if it looks good. Obviously, they're public documents once you put on your website. If you find one that someone else has done that looks really good, you could just use that. But there are loads of them. But you should, it's not just necessarily a case of grabbing someone else's. It should be your own, albeit that given you all pretty much do the same thing, they are going to be very similar. Ensure that you understand it and that you've had a look through it, and it does actually reflect what the practice does. Privacy notice is a very strong, from the ICO, obviously Commissioner's Office, who regulates all the information, all the uses of information. They see privacy notice as being a very important thing that you must have. Certainly, if anything goes wrong, it's the first thing they'd ask to see. Have you described the use of people's data? Okay, the next one down then is the national data opt-out. So this, I'm hoping that the system's been changed, because the deadline for this was fairly recently, although they then put it back to beyond the 30th of June. And the last time I was on a webinar with the NHS Digital, they said they were going to change the system to make this one not be mandatory, because when up until recently, it was mandatory for the 30th of June submission that you could say you'd done the work that you needed to do for the national data opt-out because it had passed the deadline already. Now that they've put the deadline for compliance back, and I think it's the end of July, essentially they couldn't make it mandatory on here. So it shouldn't say that. Having said that, I suspect that you all are compliant anyway. Certainly, if your processing of data is through your clinical system, then it will be, because both EMIS and TPP System 1 are compliant as systems. Where you need to be aware of the data opt-out would be if you're using it outside that system. So if you, I think a kind of simplistic example would be if one of the GPs is running a research project and he's collecting data on patients potentially as they've come in, or however he's seen them and collated it, and that would be an example, going back to what we talked about earlier, where he'd need to get their consent. He'd also need to ensure that they hadn't done a national data opt-out, although it's kind of, if you ask for consent, it's unlikely that they would have anyway, but you need to have a process in place that would ensure that for that data collection and that processing of data, which has been done outside your clinical system, that the national data opt-out has been applied to it. And you can actually just use the clinical system to tell you that, because it will show whether a patient has applied for a national data opt-out anyway. So But as I say, I don't think that should have been changed to be not mandatory anyway. Although, as I say, you probably are compliant. Confirm that you have policies in place that explain data protection quality. Okay, we've been doing this for at least 20 years now. If you haven't got policies in place now, what have you been doing for the last 20 years? Having said that, there are example policies, which is the last update on our IG portal. The most recent blog that I literally just put on this morning gives you a link to a website which is actually designed by social care people, because they're starting to use Data Security Protection Toolkit and into care homes and so on. And they've produced a very good set of policies and loads of templates that people can use. And so it kind of, the link is there for you to go and get some. If you feel there's a policy that you don't have, they're all there for you. Okay, organizations should carry out spot checks on staff. This is always a difficult one. I appreciate how busy you are, and you know, is it realistic to be doing spot checks and so on? I think it should be, because I think we have had, certainly in the last year or going back a few months, not so much recently, but going back probably a year or so ago, there were a number of occasions or incidents that came up where staff had inappropriately accessed records. It was family members and people they knew and neighbours that were coming up. So I don't know if that's still an issue. I suspect it will always to some extent be an issue. And I think it's good practice just to keep just to let people know that you're doing these checks, because actually it's a big deterrent. One of the problems I think we came across when we looked into some of these incidents last year was that people had no sense that they would ever get caught. So if someone was looking inappropriately at a neighbour's record, for example, they were absolutely amazed that when they did get caught, and most of them were caught because someone then did something with the information they found. But people had a perception that they would never get caught. No one ever checks this. If I've got access to all this information, if I look at this record, then it's just what it is. So I think it's useful to say and to make a kind of almost make a big fuss about it. Say, I'm going to be doing these checks, to tell people. You tell one person in the staff room, it'll be around the practice by the within the next hour or so that you're doing checks that morning. How many checks you then actually do is a slightly different question, I guess. But certainly, yeah, the system requires that you should be doing spot checks and have and document them, and that's what that assertion is about. And the sort of, without doing system audits, the other things you might want to do, you could just check people are using their own smart cards. They're not borrowing them and lending them and things like that. That's a fairly straightforward one that you could just do by having a quick walk around around the offices. So there's a requirement there that you're carrying out spot checks on staff. Next one down says, yeah, this is a slightly odd one. This is actually to come up with stuff yourself. So it talks about all organizations will have risks. You should be able to identify what they are. And it says you just got to really kind of think about them, think about what's in the toolkit, think about the sort of questions that you've been asked, and consider which of the 3 risks or 3 areas that carry most risk, and then literally write them in there. So you may want to consider things such as staff inappropriate access to records. You may want to put technical issues around people hacking into the system, people spoofing others to get treatment they're not entitled to, which links into patient registrations. There are loads. This isn't one we can really tell you about or give you a template. It's absolutely up to you guys to consider it and just put something in. There's no kind of right or wrong answer here either as well. It's whatever you consider to be the biggest risk that you have. Or it wants 3, actually, the 3 biggest risks. Okay, so we're into now looking at new processes, and this thing's called data protection impact assessments. Now, these are something that came in with GDPR. They're a mandatory requirement when you're doing something new or if you do a significant change. So the main one that you're going to get, and some examples would be if you change a clinical system, so you change, for example, from system 1 to EMIS or EMIS to system 1, that is deemed to be a significant change, and you would need to do a data protection impact assessment. Now, clearly, it's that in itself is a process we've done many times. We've got a template for it, and it's unlikely you're going to get a risk coming up that would stop it going ahead, for example, or that would say, hang on, we need to totally change this because we've identified a huge risk. However, it is still important to identify the risks that are there, and ensure that you're taking care of them. However, there could be other ones. For example, many of you have been installing CCTV systems, so it may be that well, certainly if you do, that would represent a fairly new major processing, and you should have a DPIA to do that. So again, there's a template for doing that, for completing a DPIA. I'm trying to think. Oh, the other one, which I know we've done, is new telephone systems, where you now maybe that you didn't record all the telephone conversations that you had previously. So that in itself, and I know we've done a couple of those where practices have put in new telephone systems, and we've done a DPIA. And like I say, they are a mandatory requirement under GDPR. And they're not overly complex. They can look a little bit at first. Some of the, and there are different templates. I think the one that we've got is a fairly cut down version, and it's just big boxes and just asks you to describe what you're doing. You're installing a new telephone system. It's going to record everyone's data. How will you tell people about it? You put it on your privacy notice. How long are you going to keep the information? Keep it for 6 months. Why do you do that? I don't know. We thought about it. We think that's reasonable. They're the sort of questions and things that it would lead you through. So that's DPIAs for new processing. Publishing your policies. Yeah, it says to meet the transparency requirements of GDPR, you should publish your policies on your website. I'm not entirely sure that's really the case, but the system, it's not an absolute must, but it's a way of meeting, as it says, to meet the transparency requirements. GDPR likes you to, obviously things like the privacy notice, it likes you to be telling everybody what you're doing. I'm not sure that an internal policy that applies just to your staff is necessarily something that the public need to know. But as you say, a lot of people do. I don't see any harm in doing it. You may just find it useful to put them all together and have a link on your website so that people can see them if they really wanted to. Okay, the next one says physical controls that can support data protection. So this is literally the physical security of your building. Have you talked about this? Do you have talks on here, secure areas, areas that aren't available to the public? I know it's always, it's a conundrum, isn't it? You go into the waiting room, as I've been into many of your waiting rooms, and you have a reception desk there that's all good, and you have your doors off, but then the thing comes up and says, well, patient number 3, go to room number 7. And that's down the corridor, past all these open rooms where people are working, and occasionally where they're not, down to, in a corridor to the room where you need to be seen. It's very rare that something would happen, but it is something you think about. Your patients will be walking sometimes back and forth. Sometimes after their consultation, they'll walk back, they'll miss a turning, they'll go off down into the wrong bit where they're not supposed to be. Worth just having to think about that. Could that happen at your practice, where you have very secure areas? Do you need key locks, sort of push button locks on doors and that type of thing, and into library areas? Just worth thinking about. And then obviously the overall physical security of your building. Ensure that, I'm sure you have, that you think about what happens at night, locking up procedures, all that sort of stuff. And then depending a little bit on the type of area you're in, what sort of security do you have during the evening and at night times and weekends? But these are all, again, these aren't questions, these are assertions that are saying, have you thought about this? It's not saying there's a right or wrong answer to this. It's saying these are things that you should consider. And if you can say, yes, I've done that, I've thought about that, that's fine. Okay. Retention timetable. Okay, you know what I'm going to say here. We've got an example for you on the portal there. I would suggest you adopt the NHS one. There's an NHS records management document that lists every type of record you could possibly think of. I think we almost thought we'd found one, a specific type of record the other week. I had a recruiter in practice. I've never heard of one of those before, and it was the, oh, I forget, was it the counterfoil to a death certificate, I think. Something like that. Something like that. It was like the stub of a counterfoil book or something like that, something unusual. So we've come across one we never found, but we actually managed to dig through and find a reference to it in that document, which is, say, it's a massive document. And I would suggest you just base your records management retention processes on the NHS one. You know, it's fairly straightforward. Okay, this is around now destroying information, ensuring that you get rid of it when you don't need it anymore. So in terms of any electronic equipment, as it says in here, old computers, laptops, CDs, memory sticks, anything like that, you don't have to worry about it. You give it back to us. We do the formal destruction on your behalf. This is one where, you know, you can simply refer to your IT service, which you have a contract for, and we'll get rid of all of that stuff. The bit you should ensure that you're getting rid of properly, however, is paper. So you should have, whether you have a full-blown contract with a shredding company that does the disposal, or whether you just buy in the appropriate shredders that can, you know, that can get rid of the documents that you've got. That's just something you need to ensure that you've got in place. Okay, not too much longer to go here. So you should have an induction process that covers when new staff come in, talks to them about who have access to personal data. We've got a fairly brief one as well. It talks about trustees and volunteers. Obviously, during COVID, we had a lot of volunteers coming along, people just manning car parks, people manning reception desks and so on, who just wanted to come along and help. And at that point, we produced it's a single page sort of list of things just to be aware of. You know, don't discuss anything you may overhear. If you see information relating to an individual, or you see someone comes in, you know, they've got a right to privacy over the fact they've even just been into the doctors on that day. Don't discuss it outside that work environment. So we've got this again on the web portal there. There's a volunteers guide to security you can use, but obviously everyone else should have the full induction process. Next one down, clauses and contracts should include appropriate references. Again, I'm sure you've all got this stuff in place, but again, there are examples if not. But it says at the end there, it should go all the way down to volunteers and people just coming in to do short-term work and stuff like that. And it's quite easy just to put something in place to cover that as well. Staff awareness. So you should be doing awareness training for people. Everyone in the organization should complete, it says an appropriate data security training every year. That is to some extent down to you guys. Larger NHS organizations have a very specific training regime that they must follow. You guys can do it slightly differently. You can do it around what you think is appropriate. It needs to be, you know, fairly good, but there are ones you can buy into. I think some of the CCGs have provided different ones, or you can indeed just use the NHS one itself as well, which is on their Information Learning for Health site, which you can log on to that with your B codes, and staff can use that. Or you can do a mix of face-to-face training as well. There's a presentation that I do that would be appropriate. It's about an hour or so, and there's a recording of last year's is on the video section of our IG portal. You could use that. The main thing if you're doing that type of stuff is getting a sense of staff comprehension. So obviously, if you do the online stuff, there'll be a test at the end. If you're saying to someone to sit and watch a video, you have to have some mechanism of saying, okay, did you watch that? Tell me what you thought of it, you know, and get a sense of that they understood what they've watched, and not they've just been sitting there, you know, reading a book while they're watching something on, you know, on Facebook or whatever. You need to ensure that if staff are doing that type of training, that they're understanding that there's a level of comprehension, and that would probably do so it can be tailored. So if you've got, small numbers of staff and part-time staff, it may be enough just to say, okay, have a discussion around something, watch a short video, read a couple of things, and then by you asking them, okay, you will gain a sense of, have they understood it? Do they? You're the ones who are going to carry the risk of your staff not understanding this, so therefore you need to ensure yourselves that they do. So that, and you can probably get that just from a conversation or asking some questions. Okay, but it should be up to 95% of people every year of all your staff should do that, and that the 95% allows for people being off on sickness and maternity and stuff like that. Right now, almost done, I'm pretty sure. Okay, you should have a list of all staff. Obviously, I'm sure you have volunteers and roles and so on. So perhaps just off your payroll system or something like that. Just knowing who you've got, really. Maintain current list of staff, and the system access that they've got. So in terms of system access, the smart card system will do that for you. You can ask our guys to give you a printout, or you can go on yourself and look at your organization. And of course, you should be doing this on a fairly regular basis. You're either doing it absolutely on your start or leaver process. Obviously, your starters, you'll have you very quickly ensure that they get a smart card because they need that to work. But when they leave, are you ensuring that you're moving their access rights as they leave? And occasionally just doing a profile check on the organization to make sure that you've done that, make sure you haven't missed anyone who left without taking their access rights off. And that should be a regular thing that you do. And our RA team can help you do that as well if you want to ask them for any assistance with that. But that will also show you staff roles and the types of system access they've got, which is always worth just checking that everyone's got the right levels of access. And this one's very similar. It's exactly what I was just saying. In order to make sure that people have got the right access levels, and that your leavers policy is working, and you're picking people up, including, as it says there, shared email addresses. And that as people move across site, people might move to another practice, ensuring that you remove their access at yours before they get onto the new one. IT system administrators. Sometimes this is more about, because some large practices have system admin people. Also, we occasionally give out admin rights because we know that you need to do stuff on the computers yourselves. So there's a way of devolving access rights. You just need to ensure that the people who have those rights and who get admin right devolved to you, that you understand exactly what the implications are of having those access rights, and you expect it to be at a higher level. Now, I think this is one where it requires you to be assured. Yeah, it does. So what I should say, this is the first of the technical ones. A number of these as we go through, actually, I'm going to say, okay, that's technical data which we're going to get to you. So in the next week or so, I was just talking to the guys yesterday in the office. They're putting together a pack which will give you all the technical answers that you need. So all the ones through here where I say, okay, that's going to need a technical one. So for example, all our guys who've got system admin access rights have signed a separate document and have had a separate briefing on the levels of access that they will get. Essentially their system admin almost allows them to do anything. So all the normal security stuff within our systems, you have to have a way of managing that by allowing someone with admin rights to be able to go in and override some of the controls to be able to do certain things. And in that scenario, those guys have all signed a very specific document about that, and we will give you that that document and that technical details as part of our technical pack. Staff should be aware that their systems are monitored and recorded. If you ever get a chance to look at it, and again, we've got a screenshot of it, when you log on to our computer systems, you get that thing comes up. After you've had the lovely Microsoft picture of whatever today's fantastic scene from around the world is, when you then go to log in, the next one is a little screenshot that comes up that tells people that their access may be monitored and all that sort of stuff. And that's, so that kind of meets meets that requirement. Okay. And then the next one down, yes, that is the very specific bit that we can do, because our staff do all the activities of someone with admin rights are logged within the system. So and they're reviewed as well to see what they've done. So we're very strong on that, where the service desk guys occasionally need to use admin rights to install new software and so on. We run reports at the end of each week that will show us what they've been doing, and we double check that it was all done appropriately and so on. And so that's part of the admin pack that you can get. Right. Confirm your organization's processes in place. Review process. Okay, so this is about doing sort of lessons learned type thing, where something happens, reviewing what happened, checking that it was all appropriate, or what went wrong in some cases, and ensuring that people, as I said, aren't doing workarounds to get over controls, forwarding emails to personal emails. That's something which we have seen, I'm afraid. It's, you just need to ensure that people are aware of these sorts of things going on. And if you've had no breaches, or if you've had a security breach, obviously you've reviewed it. If you haven't, you haven't, and you just put no, not applicable. But if you have, it's good practice to say, yes, I've done that, and we do regular reviews and discuss things like that at team meetings and so on. It talks about here of saying how you review things, who would be involved in that review, and any briefings that would have been carried out. Confirmation that a functioning data security and protection breach reporting mechanism is in place. Right. So we actually give you the system. So when you're logged on to the data security and protection website, you'll see along the top when you first log in that there is an incident management system. So the system itself gives you this this reporting mechanism. And whenever you have a data breach that involves something to do with someone's personal data, you must use this. So you'd be aware GDPR brought in a requirement that all organizations must report all data breaches. Now, the wording, it says to the Information Commissioner's Office, to the ICO. So that's something that we'd always done. Across public sector, we had always been required to report data breaches. So the NHS had it, and various others. And that's one of the conundrums that always used to annoy people, I suspect. They used to say, look at how many data breaches the NHS get and how bad we are at losing data. Well, that was because we were mandated to report every single data breach. Normal companies, the private sector, didn't have to do that. Once GDPR came in, of course, they did. So there's a requirement, everybody is required to report data breaches. One of the consequences of that is that the ICO is just getting too much stuff coming through. So the NHS have created this system here. And what it does, when you report a data breach through the security toolkit, it will grade it. So it'll ask you some basic questions like what's happened, and you get a text box just to write stuff in. And then it will ask you some very specific questions about how many people were involved. Was there any press involvement? And there are a number of questions that are either a specific number or there are yes/no questions. And based on those questions and your answers, will decide whether the incident that you're reporting needs to actually go to the ICO or not. So, and the ICO has approved this. So although the requirement is you report all data breaches to the ICO, it actually, the way we're allowed to interpret that is that we report all data breaches through our system, through the NHS Data Security Protection Toolkit system, and where that system deems that the incident has passed a certain bar, it will report it on to the ICO for you anyway in the format that they want. But for the majority, if they're just if it's a single data breach, for example, you send an email to the wrong person, then the chances are that's not going to be reportable, but it will stay within the system. And then also you've got it there, that's your system, you can review it at the end of the year, you can click on, see, get a report on how many data incidents you've had, and that's what the system is there for. It's there for you to be able to review as well as report. So the answer to that, the assertion there is that yes, you are, and that you do, and that you use the system that's been made available to you. Data breaches should be reported. and to the nominated individuals. Should also be reported to, if I'm your data protection officer, to me, and then you should do lessons learned and action plans and all that sort of stuff. If you've done that, just confirm that you have. If you haven't done a data breach, then it's just not applicable. These are the ones that are likely to be reported to the ICO. It talks about a data breach likely to result in a high risk of adversely affecting individuals' rights and freedoms. That tends to depend on the numbers involved, what happened to the data. So as I mentioned earlier on, a straightforward one like sending an email to the wrong email address, as long as that address doesn't happen to be the local newspaper, certainly if it stayed within the NHS system, then it's unlikely to be reportable beyond that. Right, these are, I think we're into the technical ones at the end here mostly. So this talks about all devices. So on the left-hand side, so all user devices are subject to antivirus protections, email services of spam filtering. Yep, so we've got all of this. So that's a technical one, and we'll provide you with the information on it. But yes, all your systems have got antivirus on them, and they've got all the protections that you'd expect. Jump back to incidents again here. So vulnerability, these are really looking at technical vulnerabilities. If you look at the thing on the left where it says known vulnerabilities are acted on based on advice from NHS Digital. So we get weekly stuff coming through from NHS Digital, telling us what to do if we need to put specific patches on computers. And what they're saying is the issues if you leave something. So systems are always going to have problems, issues, vulnerabilities, but we need to ensure that we're fixing them so that we don't get the same ones coming around again. But the details on that one will be on your technical backup, as will this one here, which is around business continuity plans. So we will give you some level of what we've got, but you should have a plan in place. And the obvious examples here are if you have a power cut, internet goes down, you get hacked, fire, what would you do? Now, what it isn't saying, and if you know business continuity, it doesn't say that you should have, essentially another building somewhere else that has all your computers and all the same stuff that you could just, oh, well, our building burnt down last night, we'll just go and work from this one. It talks about, you've got to be reasonable, and no one has two of everything. What would you do, however, if you thought the scenarios? Could you can access your systems, your data from anywhere. So, we can probably very quickly give you new IT systems. Do you have somewhere you could set them up? Just have you thought about what would happen essentially on these sort of things? And that's what a good continuity plan will do. It's not going to give you the answer to everything, because obviously you don't know what your situation is going to be, but it'll give you some ideas of the sort of things you'd be thinking about. Does your incident plan include contact numbers and phone numbers as well as emails? And do you have a copy of it in hard copy, for example, in case your phone system or email system's down? Do you have a copy of it at home? Certainly, if you're, for the practice managers, do you have people's phone numbers that you could ring if you can't get into your main building? That's your sort of good continuity stuff. Backups, all right, again, think for us, we'll sort your backups out, and we'll give you all the details you need in the tech pack that we send out. What's the strategy for system updates? Again, yep, that's what we put in place. We have a strategy that does that. Default passwords have been changed. Yep, we can confirm that that's been done. And that you've had penetration testing. Again, that's been done. You can be assured, first of all, the other thing to be assured about this is that we've now got appropriate assurance things ourselves. So we have this thing called Cyber Essentials Plus and ISO 27001. So we've now got these certifications as an IT provider, which is something we've never had in the past. So that gives you a level of assurance. And obviously we can then give you that assurance to complete this to the appropriate level, because obviously we complete our version of this toolkit as well, putting all those things in. Register of medical devices. And this is a new one that's just come in. If you're if you've got medical devices that you're connecting to the network, you need to register them, as it says there. Register, it says your vendor, maintenance arrangements, and so on. It's not, they're not all that common, I don't think, and it's a new one that's come out, and it's probably the one that we haven't got an advice sheet on, because it's something I'm still working on and still trying to kind of understand some of it. But if you do think you've got this sort of stuff, basically you should have it registered. You should know what you've got, what stuff you are plugging into the network. But I'll try and get some more out about that. It's not one that we've really had in here before. Laptops, removable devices are encrypted. Yes, they are. And again, that's part of the technical assurance. On the other side, it then says things like memory sticks, cards, and CDs. Well, hopefully we've got past the stage of using those. No one should be using memory sticks. The only people authorized to use those are our technical guys, because they carry around a whole copy of all our software and stuff so that they can re-image your computers on site, and they'll have all of that on a memory stick. You guys shouldn't need them. You shouldn't need to move any data like that anymore. Shouldn't need to use CDs at all. Again, 10, 15 years old technology, and very vulnerable, as it says there. So you just shouldn't use them at all. But everything else is encrypted that we've got. Does your organization have a list of suppliers that handle personal information? So where you're getting, so obviously you have a contract with us, you have a contract through the CCG with your clinical system supplier, but where you have other things, accountancy systems, an HR system, payroll, you should have, wherever you've got a contract in place, it just says, have you got a list of it? And I'm sure you'll have a file or a folder system somewhere that'll have it all. It's just ensuring that you've got that in place, and then ensuring that they have got appropriate certification. So I just mentioned there exactly what it says here. Does your organization's IT system have cyber security? Well, obviously the actual contract for it isn't what you do, the CCG contract with us for us to provide you with that service, but I can show you that we've got the two mentions on there, which I just talked about, Cyber Essentials and ISO 27001. And obviously we do this, we complete this to a high standard as well. So all the contracts you've got where people are handling personal data are compliant with ICO guidance. So our contract is the one we have that CCG's put in place, but you should ensure that any others that you've got where you're dealing with personal data, if you have a contract with someone else to do certain types of systems, you need to ensure that contract is compliant. I think that's almost it. It is. We're done. Okay, so that's complete. Yeah, I don't think there's anything else to kind of add, unless anyone wants to have any questions at that point. Anything anyone feels that I've missed? Anything you want me to go back and expand on, anything like that? Okay, I'll take that as a no. I can't see the chat for me. Are there any questions in the chat?
Yeah, there's been a couple. If you just give me a minute, I'll scroll up and
okay.
read them out.
Let me just see if I can get to it actually myself. I stop sharing.
Yeah, I've got them. So if you find them yourself, I can read them out to you. It's not a problem.
Okay, I've got them now actually.
Okay,
Let's
wonderful.
have a look. Can I review? Yeah, Fiona, absolutely anything. If you guys have got policies, procedures, anything you'd like me to review, I'm more than happy to do that. If you just want to send it to me, say, does this look right? Yep, I'll do that. No problem at all. Michelle has put off to a meeting. As I said, this has been recorded. It'll be on the on our portal this afternoon. Could the awareness be done at perhaps at the same time? Staff awareness. Yeah, so yeah, you can get together. I'm in the process of starting up, going out and doing staff visits, practice visits for those that want it. I've got 2 scheduled so far. I'm not really advertising yet. I want to see how these go. Those of you who knew me going back when I first started here will know when I was around in Brigg and Grimsby that coming out to practices on your protected time events, I really enjoy doing that. I'm one of these people, I can talk for England, as you probably realise. and certainly that level of staff engagement is great. It helps me, and I think it's a good way of putting a lot of this stuff over to staff as well. So if you can get a lot of people together, to some extent, the more the better, really. It saves me coming out and doing lots of smaller events at smaller practices. If you can get people together, yeah, I can do we can do it all at the same time. So Amanda, I'll get back to you on that one, and if you want to see if we can sort something out, I'm sure we can do that. Okay, that's everything that was in the chat, I think. Well, thank you all for coming along this morning. Again, the two messages I think I would just say on top of everything, have a look in our IG portal. There's loads of stuff. If you go down the blogs and go onto, 2 or 3 pages further on, there'll be stuff. I think, as I said, probably apart from that one, which is about the medical devices, I'm fairly confident that there is something on there to cover off every one of those assertions that we've talked about and all the things that you would potentially need. We'll be getting the tech pack out to you. Well, we'll put it on the portal within the next week or so, a couple of weeks, and I'll let you know. Submission date is the 30th of June. Remember to actually submit. In the past, we've had people fill it all out and think, okay, it's not actually the 30th of June yet. I'll leave it for a bit. I want to go and double check something, and then you actually forget to go back on and press the submit button. Just make sure that you don't forget and you go back on and do that. I'll probably send you a reminder out near the time just to double check on that one. And again, as I said, any queries whatsoever that you've got, just drop us an email and we'll get back to you. Okay, I'll let you crack on with your day. That's almost exactly an hour. How good was that? Okay, thanks everyone. Have a lovely day. Bye now.